The prostate gland, a crucial yet often underappreciated component of male reproductive health, plays a pivotal role in the production of seminal fluid, which nourishes and transports sperm. While the testes and penis typically dominate conversations about male sexual health, the prostate's function is equally vital, acting as both a secretory organ and a gateway for ejaculation. Its health is deeply intertwined with sexual activity, including masturbation, a common and natural practice. Daily masturbation in particular can lead to a spectrum of physiological changes within the prostate, some beneficial and others warranting cautious attention. Understanding these shifts requires a nuanced exploration of the gland's biology, hormonal interactions, and adaptive responses to frequent stimulation. By examining the intricate balance between activity and recovery, as well as the potential consequences of overstimulation, men can better navigate the complexities of maintaining prostate health while engaging in regular sexual practices. When considering the effects of daily masturbation on the prostate, one immediate consequence is the increased workload imposed on the gland. The prostate's primary role is to secrete a milky fluid that constitutes a significant portion of semen. This fluid contains enzymes, zinc and citric acid, which are essential for sperm motility and survival. Each ejaculation triggers a coordinated effort. The prostate contracts rhythmically to expel its secretions into the urethra, mixing with sperm from the testes and fluids from the seminal vesicles. For men who masturbate daily, this process becomes a routine demand, akin to exercising a muscle group repeatedly. Over time, the gland adapts by enhancing its operational efficiency. Cellular activity within the prostate may increase, with epithelial cells ramping up production to meet the consistent demand for seminal fluid. This adaptation is not inherently harmful, much like how muscles grow stronger with regular exercise, but it does lead to temporary physical changes. The prostate may enlarge slightly due to heightened activity, a condition known as physiologic hypertrophy. While this enlargement is typically benign, it can cause sensations of pressure or fullness in the pelvic region, particularly if the gland isn't afforded adequate time to recover between ejaculatory events. Men might notice a subtle awareness of their prostate, a feeling that underscores the gland's active engagement in meeting the body's demands. Blood flow dynamics within the pelvic region further illustrate the prostate's response to daily stimulation. During arousal, the body directs increased blood flow to the genitals and surrounding structures, including the prostate. This engorgement, part of the natural sexual response cycle, causes the gland to swell temporarily. Post-ejaculation, the prostate gradually returns to its baseline state as blood flow normalizes. However, with daily masturbation, this cycle of swelling and subsiding becomes a recurring event. While the swelling is usually mild and transient, it can lead to heightened sensitivity in the gland. Some men report a lingering sense of fullness or a faint throbbing in the pelvic area after frequent ejaculation. These sensations, while generally harmless, highlight the prostate's reactive nature. In rare cases, persistent swelling could signal underlying inflammation, especially if accompanied by discomfort during urination or ejaculation. Monitoring these symptoms is crucial, as they may indicate conditions like prostatitis, which requires medical intervention. The interplay between vascular changes and glandular activity underscores the importance of moderation, allowing the prostate time to reset and maintain equilibrium. A notable benefit of regular ejaculation is the enhanced drainage of prostatic fluid. The prostate, like any secretory gland, can accumulate stagnant fluids if not regularly emptied. Ejaculation serves as a natural flushing mechanism, expelling not just seminal fluid but also potential irritants or pathogens that might linger in the glandular ducts. Studies have suggested that men who ejaculate frequently, defined as 21 or more times per month, may have a reduced risk of prostate cancer, possibly due to this cleansing effect. The theory posits that regular expulsion of fluids helps eliminate carcinogenic compounds or cellular debris that could otherwise contribute to malignant changes. However, this protective effect exists within a delicate balance. Overstimulation, particularly without adequate hydration or nutrition, might strain the prostate, leading to fatigue or subclinical inflammation. For instance, the gland's epithelial cells responsible for fluid production require nutrients like zinc and antioxidants to function optimally. A diet deficient in these elements, combined with frequent ejaculation, could impair the prostate's ability to replenish its secretions, potentially leading to oxidative stress. Thus, while regular drainage is advantageous, it must be paired with lifestyle choices that support the gland's metabolic needs. Hormonal regulation adds another layer of complexity to the prostate's response to daily masturbation. The gland is exquisitely sensitive to androgens, particularly dihydrotestosterone (DHT), a potent derivative of testosterone. These hormones regulate prostate growth, secretory function, and cellular turnover. Frequent ejaculation can subtly influence the hypothalamic pituitary gonadal axis, the hormonal feedback loop governing testosterone production. Some research indicates that acute spikes in sexual activity may transiently lower circulating testosterone levels, as the body prioritizes replenishing seminal fluid components. Over time, however, the endocrine system typically adapts, maintaining hormonal equilibrium. For men with predispositions to conditions like benign prostatic hyperplasia (BPH), these hormonal shifts might exacerbate symptoms. DHT, known to stimulate prostate growth, could contribute to glandular enlargement if its levels remain elevated due to frequent sexual activity. Conversely, other studies suggest that regular ejaculation might help modulate androgen receptor activity, potentially mitigating excessive growth. This duality underscores the need for individualized approaches, recognizing that hormonal responses can vary widely based on genetics, age, and overall health. The concept of prostate fatigue emerges when considering the cumulative effects of daily masturbation. While the prostate lacks muscle tissue, its smooth muscle components and surrounding pelvic floor muscles undergo repetitive contraction during ejaculation. Over time, this can lead to a state of overexertion, akin to how skeletal muscles tire after prolonged use. Symptoms of prostate fatigue might include diminished ejaculatory force, reduced semen volume, or a lingering sense of heaviness in the perineum. These signs suggest that the gland and its associated neuromuscular structures require rest to recover fully. Incorporating periods of abstinence, even brief ones, can allow the prostate to reset, restoring its secretory capacity and reducing sensitivity. Additionally, practices such as pelvic floor exercises or yoga may enhance muscular resilience, supporting the prostate's functional demands. Recognizing fatigue early and adjusting habits accordingly can prevent more severe complications, such as chronic pelvic pain syndrome, a condition often linked to overuse and muscular dysfunction. Inflammation and irritation represent potential risks of excessive masturbation. The prostate's delicate tissues can become aggravated by repetitive mechanical stimulation, especially if techniques are vigorous or lack sufficient lubrication. Friction during masturbation may cause microtrauma to the urethra or prostate ducts, creating entry points for bacteria or triggering an immune response. Non-bacterial prostatitis, characterized by pelvic pain and urinary symptoms, is sometimes associated with such overstimulation. Men might experience a burning sensation post-ejaculation, difficulty initiating urination, or a frequent urge to urinate, all hallmarks of prostatic inflammation. Preventative measures, including using lubricants, avoiding aggressive techniques, and ensuring proper hygiene, can mitigate these risks. Moreover, addressing underlying conditions like urinary tract infections promptly is essential, as unresolved infections can ascend to the prostate, compounding inflammation. Long-term implications of daily masturbation on prostate health are a topic of ongoing research. Epidemiological studies have yielded conflicting results, with some indicating a protective effect against prostate cancer and others suggesting no significant association. A meta-analysis published in the Journal of Sexual Medicine found that frequent ejaculation, greater than or equal to 21 times monthly, correlated with a 33% reduction in prostate cancer risk, possibly due to the aforementioned drainage mechanism. However, these findings are observational and do not establish causation. Conversely, concerns persist that chronic prostate stimulation might accelerate cellular proliferation, theoretically increasing cancer risk. Disentangling these effects requires considering confounding factors, such as lifestyle choices, genetic predispositions, and access to healthcare. For instance, men who masturbate frequently might also engage in healthier behaviors, like regular exercise, that independently lower cancer risk. Thus, while the current evidence leans toward a protective role for moderate ejaculation, Excessive practices should be approached with caution, particularly in individuals with a family history of prostate disease. The psychological dimensions of daily masturbation also intersect with prostate health. Stress and anxiety, common in modern life, often drive compulsive sexual behaviors. While masturbation can temporarily alleviate stress through endorphin release, excessive reliance on it as a coping mechanism may lead to guilt or shame, exacerbating mental health struggles. Chronic stress itself is a known risk factor for inflammation, potentially creating a vicious cycle where stress prompts masturbation, which in turn strains the prostate, further heightening stress. Addressing the root causes of compulsive behavior through therapy, mindfulness practices, or stress management techniques can break this cycle, promoting both mental and prostate health. Furthermore, societal attitudes toward masturbation, ranging from stigmatization to normalization, influence how men perceive and discuss their habits, potentially affecting their willingness to seek medical advice when symptoms arise. Nutritional and lifestyle factors play a critical role in supporting prostate health amidst frequent masturbation. The gland's high zinc content, essential for seminal fluid production, means that dietary zinc intake is crucial. Oysters, pumpkin seeds, and legumes are rich sources, but supplementation may be necessary for those with deficiencies. Antioxidants like vitamin E and selenium combat oxidative stress, which can damage prostatic cells during periods of high activity. Omega-3 fatty acids found in fatty fish and flax seeds possess anti-inflammatory properties that may counteract irritation from frequent ejaculation. Hydration is equally vital. Adequate water intake ensures that seminal fluid remains fluid and less likely to stagnate. Conversely, habits like excessive alcohol consumption or smoking can exacerbate prostate inflammation, undermining the gland's resilience. A holistic approach, integrating diet, exercise, and mindful masturbation practices, fosters a prostate-friendly lifestyle. In conclusion, the prostate's response to daily masturbation is a tapestry of adaptation and vulnerability. While the gland's ability to enhance drainage, modulate hormones, and adapt to increased demand is remarkable, these benefits coexist with risks of fatigue, inflammation, and hormonal imbalance. Men navigating this terrain must cultivate awareness of their bodies, recognizing when habits tip from beneficial to harmful. Symptoms like persistent pelvic discomfort, urinary changes, or ejaculatory pain warrant prompt medical evaluation. Embracing a balanced approach, combining moderation, nutrient-rich diets, stress management, and open dialogue with healthcare providers, ensures that the prostate remains a resilient ally in reproductive and sexual health. As research evolves, so too will our understanding of this complex interplay, offering men ever more nuanced strategies to harmonize their sexual practices with long-term well-being.